May all be happy. May all be healthy. May everyone get to see only goodness, and may none be distressed. This understanding that health and happiness are intertwined is at the foundation of this powerful benediction mantra from our scriptures. Also, the word sarve is the key which conveys the idea of Vasudhaiva Kutumbakam. Is it not imperative, then, for the world to come together to face global health challenges holistically as one family? How much do physical, mental, and emotional health contribute to the general well-being of an individual or of a nation? To ponder on these and other health issues, we have the perfect panel with us today. I would like to call upon the moderator of the Health and Happiness session, Dr. Chandra Mukherji, onto the stage, please. Dr. Chandra Mukherji is a practicing neuropsychiatrist in Kolkata with special interests in pain management, epidemiology, medical history, and memory disorders. As an NHS consultant with the Northeast Thames London Regional Health Authority, he was actively involved in research and teaching. After returning to India, he has been a visiting consultant at the Calcutta Medical Research Institute, Amri Hospitals, and the National Neurosciences Centre, Peerless Hospital, Kolkata. He is a fellow of the Royal College of Psychiatrists, London, is actively involved in research and has published and presented extensively. He is the founder member of CHIP, a charitable organization for children, and a consultant for the UK-based Mentor Group. His other interests include public reading of the Gita and Savitri by Sri Aurobindo. Welcome, Dr. Mukherji.
We now call upon our eminent Dr. P.K. Pooviah, a geriatric medicine specialist. Dr. Pooviah, having completed his undergraduate studies in Kolkata, completed his postgraduate medical education in general internal medicine and thereafter a super specialty program in geriatric medicine in the UK. His special interest lies in the study and treatment of frailty in the older person. He has published in peer-reviewed international journals. He has more than 25 years of experience in adopting a holistic approach to providing solutions for the healthcare problems of older persons. Welcome, Dr. Pooviah.
I now call upon the chairman of the Mission Hospital, Dr. Satyajit Bose. Dr. Satyajit Bose, a well-known heart surgeon and founder of the Mission Hospital in Durgapur, has conducted over 45,000 heart surgeries as the chief cardiac surgeon at Apollo Hospital in Kolkata. Dr. Bose was on a mission to bring healthcare to those who could not afford it. He began by offering free heart camps and eventually quit his job to establish the first super specialty tertiary care hospital in Durgapur. Today, the Mission Hospital is a 550-bed NABH accredited hospital and the 5th best hospital in India, catering to people across Eastern India and the SAARC countries. Dr. Bose also created a super specialty eye hospital, and his healthcare model has been recognized as a case study in the Harvard Business Review and taught in business schools across the USA. Please welcome Dr. Bose.
We now invite Srimati Barkha Sharma to join us on the stage. Barkha Sharma ji is multi-talented with expertise in fashion, music, and yoga. She is the author of Global Little Yogis, a comprehensive guide to yoga for children aged 5 and above, which offers a unique blend of yoga philosophy with modern wellness practices. Barkha ji's background is diverse. She graduated from Purdue University, completed marketing and entrepreneurship programs at the Wharton Business School and Harvard University, respectively, and is a certified skydiver and has studied Lido and Tibetan meditation. Barkha ji is a co-founder of the fashion label Barkha and Sonzal and is a Kalari Pattayu artist from the CVN Kalari. She comes from a family of musical legends and has trained in instrumental music and learned the Tanpura from her father-in-law, the legendary Pandit Shivkumar Sharma ji. Barkha ji and her husband, the Santoor maestro, Rahul Sharma ji, have featured in the album Confluence 2. Welcome, Barkha ji. We now request Swami Mitraranji to felicitate our speakers. Thank you so much, Swamiji. With this, I request Dr. C.S. Mukherji to take over.
Namaskar and good afternoon, everybody, and welcome to this session of Health and Happiness, Indian Ethos in Healthcare. I hope that we have a fruitful discussion today. I fully expect that with this galaxy of expert people on my side. The first thing I want to say is that it seems it is entirely appropriate that the Chinmaya Mission is hosting this particular session, because I don't know how many of you know that Swami Chinmayananda's guru himself was a doctor, a medical doctor, Swami Shivananda. And I'm sure that that particular fact kind of has driven this session forward. We're going to discuss a variety of elements today, but the first thing that I just wanted to touch upon before we get going with questions and views on various topics is to focus on this one thing which is the global goals which unify all of us in healthcare. Now, all of us have become very familiar. Now, all of us have become very familiar with the one organization through the ages of the COVID pandemic, the World Health Organization, which we know is ultimately responsible for driving coordination within nations for health. In their 13th program between 2018 and 2023, the World Health Organization has devised what's called a 3 billion target, which is divided into 3 steps, that 1 billion people should have universal health coverage. Another billion people should be protected from health emergencies. And finally, a third billion people should enjoy better health and happiness. What has India's contribution to this particular set of goals been? Because now we're ending the last phase of this program. This is now 2023, and it started in 2018. So India has, in recent years, 2018 to be exact, instituted a universal health coverage program called, we know, the Ayushman Bharat. It's not functional in all states, but in the majority of states in the country. What is the Ayushman Bharat program? It is a program of universal coverage which covers approximately 500 million people in our country, the bottom 40% of our population. Just by this one act, India has contributed to 50% of the WHO's goals, these 3 goals in these 5 years. India alone has done that. So that's one contribution. During our talk today, we will cover a variety of areas. We will discuss the contribution of different traditional methods of medical and healthcare practice in our country, which have been there with us for centuries and millennia. Some of them you are familiar with. They are various. The Ayurveda, Ayurvedic practices which emanate from the Ayurveda, Unani, Siddha, Yoga. There are a variety of other ancillary practices in addition to modern medicine, which has come to dominate the health landscape, particularly in the last 150 years. We'll discuss how we can look at fusing these two together, whether it is necessary or not, and if so, how we can do it. For instance, Ayurveda, just to briefly touch on it, has given the world more than 2,000 years ago plastic surgery, cataract surgery, head trephination, which means burning a hole and taking out something from the head, which is causing compression on the brain. These surgical practices, which were more or less invented here, an understanding of how the body functions. And the great Ayurvedic scriptures, the Charak Samhita, the Shushrut Samhita, have been translated into Arabic, into Latin, into Persian many millennia ago, and has served as a basis for practitioners in other parts of the world for thousands of years. Our practices have been adopted outside, have been fused into other systems. We all know about yoga, we know about the other naturopathy, which abhors drugs and just looks at plants and medical. But we should also look at modern medicine in relation to the world and in relation to India. Because modern medicine has come to dominate health and healthcare in our country in recent years. We should look at how commercialization of medicine has impacted behavior, impacted people's ability to access healthcare. This and many other themes we shall cover, but I shall start today by asking my panelists, and I shall ask all 3 of them the same question, which is, what has been India's contribution to global healthcare, and what is the contribution that we can further make moving forward? Dr. Bose, would you like to start with that?
You've been trained in the UK, isn't it? So,
in India.
Huh?
And in India.
In India, yeah. So, essentially, in my class, 1985 batch, when we passed out our MBBS, and when I actually look at it, we did surgery. So, out of those 30 surgeons who passed out, I think I and Dr. Tapas Shah in neurology in RN Tagore and a couple of them, everybody is in the UK. So, I think the NHS is running on Indian surgeons. And actually, if you look at this list of consultants in various hospitals, it'll be either Indians or Pakistanis or Bangladeshis. Whenever I go to England to meet my friends and all that, I see that. So, we stayed back in India to serve our country, but I think this is one way India has contributed hugely to the global health scenario. Even in the US, the number of people, second generation people who have stayed back in the US, everybody's children has become a doctor. Be the father is an IT guy or whatever. Everybody has become a doctor and is contributing in the US as well as in Australia, mostly where people, Indians go and migrate. Plus, as you said, age-old medicine like the Charaka and the Susruta, the medicine part and the surgical part, I mean, they are, I think, 300 BCE. Lot of contribution has happened. But the main contribution is the workforce, the nurses of India who has gone to UK, US and are actually contributing to the healthcare scenario all over the world is a huge contribution that India is making. Another area where India is contributing is the pharmacy industry. Lot of these pharmacy industries, initially we used to have medicine companies coming from abroad, from US or UK to come, Germany to come in India. But now actually Indian companies are exporting medicines to rest of the world, and that's a huge contribution there as well. And plus then if you start digging, there'll be a lot of other things coming. I mean, you can ask the same question to others and they'll contribute.
Well, would you like to speak a little more about the general topic, which is health and happiness in the Indian ethos in healthcare, global healthcare?
Oh yes, if you like to talk about health, health is combination of two things. One is the physical health and the other is emotional health. And physical health, you know, when we as doctors look at it, we look at it as preventive, which is the mainstay of should be everywhere, and the curative health. When curative health in the OPDs, in you know, when you can't manage outside, then we have to get into a hospital. But the problem in our country is that we are making huge progresses. You know, the indicators of good health in a society are infant mortality rate, neonatal mortality rate, and maternal mortality rate. Those are steadily coming down. But what bothers me is that health being a state subject, we don't have the number of private hospitals in India is about 46,000. The number of government hospitals in India is less than 30,000. I don't remember the figures properly. But, so there is a huge dearth of facilities. Now that gap is being taken up by the private sector. And private sector has got, I'm also a private hospital owner, so the main thing is motive is sustainability also. So therefore, there'll be a lot of out-of-pocket expenses, and one of the causes of going into poverty of middle class and low middle class people is out-of-pocket expenditure in healthcare, and that is a very sorry figure. But having said this, one he talked about is the Ayushman Bharat and our Shastu Sati in Bengal and other states also. There are certain policies wherein, in fact, there is another thing that has come up in Rajasthan, that is right to health. So they're kind of gulping it down on all private hospitals that they should be getting free treatment in private hospitals. So again, this is a situation where for private hospital owners it is a tsunami because rates are abysmal and the payments are also sometimes not there. And therefore, except for the huge groups that are running around all over the country, I mean, there is a serious concern. But I think this is a situation which will have its own solution. It is just around the corner, and this is the only way, this Modi Care or this Ayushman Bharat that has come, that people, the poorer, the low down in the socio-economic strata will get good health. And we actually think that if you can have this across the people, this universal insurance coverage of 5 lakh rupees, for at least 50 crore members of the society, is a huge boon for society, but it must be very well instituted and worked out properly so that all the beneficiaries get an uniform healthcare support in that area. Another area which is very important is that the number of doctors in our country are very few, about 0.6 doctors per 1,000 population, I think, whereas the comparable figures in the West is about 3 to 4 per 1,000 population. And believe me, a lot of people over here are coming from business houses, that it is not steel industry. It is not any other industry that contributes highest to the economy of the country. It is health industry. And health industry contributes more than 37 billion US dollars per year in 2022, and it is estimated that will be 50 billion. And only closely thus come is education. But when it comes to giving it back to society, as a percentage of GDP, the government expenditure in 2023 is only 2.1%. And the comparable figures in the NHS and the US or Scandinavian EU countries is close to 8 to 14%. So that expenditure has to go up. That I think is a take-home message for the government, that the expenditure for medical health in general has to go up. And that is the only way when the entire, and India is not a small country, it is 1.3, how much? 140 crores. And you know this, you have worked in the NHS. NHS is one of the best examples of how government can give health service to this thing in the UK. But after so many immigrants going to UK, the NHS is now falling apart. It's falling apart virtually. People don't get dates for operation, and therefore the private people are now coming up, filling up the gap. So in our country, population is a huge problem. It's an advantage in some cases. Yeah, there will be a huge number of young people around, but when it comes to administering good health, then it is treatment, curative treatment. So the emphasis on the government should be prevention. Because cardiovascular deaths accounts for 25% of deaths in our country. 25%, it's a huge number. And very much preventable by a few steps. Thank you.
Thank you, Dr. Bose. Mrs. Barkha Sharma, would you like to talk on the general topic, which is health and happiness, Indian ethos and healthcare?
Definitely. Namaste. Namaste, dear friends and my esteemed panelists. I'm happy
Before
to be
Mrs.
here.
Sharma starts, let me just introduce her again. She's written this wonderful
I've
book
written
called
this book
Global
called
Young
Global Little Yogis.
Little Yogis.
It's for children 5 years and above and their families. So basically, it talks about the 30 most essential asanas for every child. And with the asana, I've also mentioned the classical rag that goes with it, or the world classical music, a spiritual animal, spiritual tree, mythological stories of India, mythological stories of the world, prayers of the world. I've interconnected like the Mayan culture, the Incas, our Aryan culture, different cultures of the world to show that we are all one. We all can bring out the best from each other. We can all bring out the best from each other holistically and join hands, and that must be started right from when they're really young. And the families need to incorporate these values with affirmations, positive prayers, and the thought processes that you are divine, that we are all divine. We're born on earth for a purpose. We're all water bubbles made of past life. And we need to realize that we have to bring out the best from each other. Our scriptures teach us. The secret's already out. Everybody knows that we're all divine, that we need to bring out the best from each other. But what are the techniques, and how do you help the weaker section of the society? And how do you help everyone become divine so that it gets into that same process throughout the world, not only in our country, but even in the US, with struggles with different issues at a grassroots level, like their schools have shootings and everything. And these things may be unheard of right now, but we need to be careful and we need to incorporate certain practices. So this book speaks about, different asanas, like I said, and for example, there's a Bhujangasana, which everybody probably knows already, but which rag goes with it. There's a rag called Malkos. My father-in-law used to say, when you listen to it carefully, you can even see the gene of Lord Shiva. So if the children are taught to do this right from age 5, I've also mentioned Vivaldi in certain sections, or Bach, or Mozart, and given the exact recommendation which concerto or which symphony to listen to, and whose symphony. and how it impacts your soul, how it impacts the different cells of your body. I've mentioned Kalari Paitu. Kalari Paitu is the martial art form of India, which went to the world, and Bodhidharma took it to the world. He took cha or chai or tea and taught the world. And why did he take cha? He used to have tea leaves while meditating. There are meditation practices for children right from 5 and their families. And if you do them, you can even do astral traveling. And all of this knowledge should be made fun so that you connect with it, so that you're in the zone and focused. And you have treasured memories that last you throughout your life. So let's create this joyful atmosphere while teaching our ancient secrets, while teaching our ancient knowledge. And I hope we can bring about this change with the technical aspects as well as a holistic way of living. So,
Thank you for that. Very different and unique perspective on health. Can I ask you a question? Should we push children to do yoga?
No, actually, the funny thing is, so my son doesn't really like yoga. He's really small, and I've, overcome all these challenges through the pandemic by starting LKG again, upper KG, grade 1, and I've seen the different impact, but he loves sports. He's into cricket, but there are different aspects like prayers, there's affirmations, there's that same values that you can incorporate into every aspect of your life. The raga, or like all of you probably know, Om is the sound of the universe. So that rag, when it gets into your body, when it gets into your cells, creates a positive effect in the body, mind, and soul, and helps one unite and see a whole different aspect of life. And yeah, so you can incorporate this for a physical benefit. Yoga has the 4 walls of ahar, vihar, achar, and vichar. Ahar means eat right food so that you have a great physical health. Then for emotional well-being, you have the right recreation. For intellectual well-being, you need to have the right thought patterns. And for mental well-being, you need to have the right routines. All of this creates selflessness. Selflessness creates a great spiritual health. And when you have that, you build resilience within yourself to overcome any challenge and to, our Bhagavad Gita teaches us to face challenges brilliantly. And then when you have that within you, you will impact the society around you. I think sages have already, spoken about the ethos of dharma and niti, and it's tested over a crucible of experience. What is right, what works, what doesn't work. When you go against it, it's going against the divine powers or going against each other, which doesn't help society in general all over the world. So we need to help the weaker section by joining hands together.
Okay, thank you for that. And you've all had an excellent exposition of the different aspects of yoga just now from Mrs. Sharma. But the answer to my question was that you shouldn't push children if they don't want to do it, right?
My answer is you can start slowly and you can build it up. I've also written how you can do it in your book.
Sure.
And yoga also is applied in different aspects of life. So while playing the santoor,
Sure.
for instance,
Yeah.
it's not that they're sitting in Vajrasan and playing or they're sitting in
That there are different
Sukhasan
aspects.
and playing the santoor. And you have to have immense meditation, immense focus, immense level of excellence, and to play a certain rag and to go deeply into it, immense mathematical calculations that match ISRO's or NASA's permutation combinations to create something. But people don't realize that and they don't know it. So I've made it fun so that children know right from the start, and so do their families.
Okay, I shall now move on and invite Dr. Pooviah to speak to us. All of you perhaps know him here. Many of you know him here. Dr. Pooviah almost single-handedly instituted the concept of geriatric medical practice in this city. And We'd be very happy to hear from you your general thoughts on health and happiness and the Indian ethos in healthcare. And
thank you very much, Dr. Mukherjee. The only thing that qualifies me to speak on this topic today is that I'm an Indian. No further qualifications. So, health and happiness, they're all interlinked. Now, when we talk about health, the first thought that comes to our mind is physical health. But that's not quite true. Health, especially being from a geriatrician's perspective, from the perspective of a physician taking care of older people, health is about physical health. That's interlinked with your mental health. That's interlinked with your social health. How you interact with society, what kind of friends you have, how many friends you have, and also financial health. Financial health plays a very important part in health, as we heard just now. With regards to India's contribution, India is an ancient culture and a culture which has evolved in a huge way in this hallowed land. Right around 600 years before the birth of Christ, 600 BC, were the first Indian texts regarding health. Patanjali, I think the name is known now more for other reasons, but sage Patanjali in 600 BC wrote the first texts with regards to yoga. Similarly, Charaka Samhita, Sushruta Samhita wrote about advanced medical practices including neurosurgery, plastic surgery, as Dr. Mukherjee mentioned earlier. So we have got a very ancient culture. Now, in the spirit of Vasudhaiva Kutumbakam, I just don't want to talk about how we have contributed to other cultures, but also how other cultures have contributed to us. We are one world. And the good thing about India, the great thing about India is our diversity. And this diversity has come from being a melting pot of all cultures. So when we call ourselves Indians, we are the original Vasudhaiva Kutumbakam. We have all sorts of genes in this land. We have got genes from Africa, from Europe, from our own country, from the Far East, the most diverse country in the world. So we have contributed and we have also absorbed. So Indian culture is a mishran, is a mixture of all these cultures. So we have contributed in the form of personnel, we have contributed in the form of medication. The pharmaceutical industry is not just new. Traditional Indian pharmaceuticals included a drug or a medicine from a plant called Sarpagandha. I'm sure lots of y'all know about it. Sarpagandha is used for hypertension. And the first antihypertensive used in allopathic medicine was Rezapine, which is Sarpagandha. So we have contributed a lot even to modern medicines long before our current R&D industry got developed. So we have contributed to pharmaceuticals, we have contributed in manpower, we have contributed in our knowledge base. At the same time, we have absorbed from other cultures. A lot of what we practice today, even in Ayurveda, even in Unani, by the very term, has come from the Middle East, from Yunnan. Chinese medicine has influenced us. Your traditional African medicines have come into lots of parts of southern India, where we had African people come and settle on the coast of southern India. So it's been a mixture. We have given a lot and we have taken a lot. With regards to the second part of the question, health and its relationship to happiness, I think mental health is a huge issue now in our country. We have got an increasing aging population with memory problems, and we have got a large number of young people who have got a significant problems with isolation due to electronic media, due to sitting on their phones. I think we heard it in the last lecture, people are now, I forget, Dr. Pillai, or rather Mr. Pillai, who mentioned about, social isolation among kids. So these are the various issues facing us right now. So you have to be mentally healthy, you have to have enough money for your basic needs, you have to be physically healthy to enjoy that money, and of course you have to have lots of friends to enjoy with. It's no point enjoying on your own. Thank you.
Thank you, Dr. Pooviah. Thank you so much. I wanted to now start a series of questions, which I will ask specific people, and other people are on the panel are welcome to contribute on that. The first one I wanted to talk about, we are in an age of specialization, at least in modern medicine. And specialization has given us a lot in terms of new techniques, new procedures, has advanced medicine in many ways. But it's also possible that specialization has caused the gaze of the specialist to shrink to the area of their speciality. And in some ways, it is possible, I'm not saying that this is necessarily true, that specialists are often unable to holistically view the patient. Dr. Bose, what would you think about that?
Today is not the age of only super specialization, it is also sub-specialization. So I'm a cardiac surgeon, I do adult cardiac surgery. So there's somebody who does pediatric cardiac surgery, somebody who does pediatric cardiology devices. Amongst us adult cardiac surgeons, somebody of us are good in aortic surgery, somebody is very good at small incision surgery. So there is a whole dichotomy over here. But at the end of the day, it is about healing. It is about healthcare should not be looked at. The problem of India is not super specialty healthcare. The problem of India is primary healthcare. The India's problem lies that only 60% of our primary health centers has one doctor only. And the 40% does not have any doctor only. An average Indian has to travel 5 to 10 kilometers to go to see a doctor or somebody who kind of masquerades as a doctor. So where is the solution? The solution, as what I have researched and found out, is decentralization of healthcare. I was very happy in Calcutta, doing 70 heart surgeries a month in Apollo and doing well for myself. But I thought that I must take this super specialty healthcare to the districts. And I chose Durgapur because that's the place where I was born. And we will not believe that Durgapur now has become the second health hub after Calcutta. And there are 11 hospitals there now, 13 cath labs, and the annual turnover of these 13 hospitals is more than 2,000 crores in Durgapur. So so the same thing can be done for Malda, for Siliguri, for wherever. And these smaller hospitals get benefited by these scheme patients. But again, coming to your point of subspecialization, is when a city grows, has got enough place, but then all these subspecialty is very, very urban oriented. What happens to people in the districts? Down in Malda or Murshidabad or maybe in Purnia in Bihar or wherever, in Jharkhand. So you have to have a very good, robust primary and secondary healthcare system. And if you don't have enough doctors, we need nurse practitioners, we need good physician assistants. And these are the people with AI-based devices, who can take pulse, who can take BP, who can take saturation, who can even predict a fall in an elderly. You're doing elder care, so there are devices who can predict a fall and raise an SOS to the concerned person. So there are the things where these kind of devices and telemedicine can bridge the gap of accessibility. My previous 5 minutes I talked was affordability. So these are the two main pillars of healthcare all across the world. All across the world. Accessibility and affordability. If these two things are met with, I don't think so healthcare will be a problem anywhere. And India can actually lead the thing in regarding these two main factors.
I mean, one of the things of Ayushman Bharat is to transform the primary health center into a wellness center.
Wellness center. So again, I tell you, wellness, being mentally all right is a very important thing. Creating mental balance. So to create the mental balance, one has to, have you ever heard of that experiment where a jar of grain and a mouse? Did you hear that? So what happens is that you leave a mouse in a jar of seeds or grains, and the mouse keeps on eating. Mouse keeps on eating, and then finally what happens is, after finishing the grain, mouse is at the bottom of the jar and now it cannot come out. So we human beings, by too much of invasion of social media in our lives, as we are exposed to a lot of good things. Previously, we didn't know in our childhood when we were in medical college that there is a car called Mercedes or somebody, we didn't know nice cars and all that, good fashion brands. We knew Fendi bag, we never knew all that. But everybody knows about everything now. So what happens is everybody is aspirational. And like the rat in that jar, if he would have taken a decision that I will not get into this and get out, then the rat would have got saved. But now we are getting immersed into our own aspirational, which is not practical, and becoming mentally upset and becoming mentally unbalanced. And the other thing is delayed gratification. Have you heard about that marshmallow experiment? That, in a room full of children, you tell them that you give, there's this marshmallows for 15 minutes. If you don't touch it, you will get 2 marshmallows. And then experimentally, it was done in the 70s, and they've seen that the children who did not touch the marshmallow for 15 minutes, went on to become hugely successful people. So this delayed gratification theory is a very important thing in our lives. Very important thing. Because in various parts of life, I want instant gratification. I like to have that biryani or that good food, I'll have it now. But don't have it now. Have it later. Delayed gratification. Then you'll not become obese, you'll not have diabetes, you'll not have all kinds of disease patterns coming. Even in sexual behavior in people, things of delayed gratification comes in, where then people can be more, marriages are breaking because of instant gratifications and all that. And there are, if you take this theory into many, many factors in life, then what happens is people become unbalanced mentally and get into depression. And among the 10 most causes of death in India, unfortunately, 3% of death has now come, yes, you know all that. 3% is because of intentional harm, death because of intentional harm to oneself. So we have to look at those areas where people mentally are happy. And this, because of our age-old wisdom that we have got from so many people, we can actually preach this mental happiness thing to rest of the world, which we are well equipped. And again, there is a data that came out last year that amongst 145 countries, apparently India is the 136th rank. I don't believe it, because I think most of the questionnaires over there were, did you have food with your parents or food with your this thing?
I think we have to look at all these statistics with some suspicion.
Yeah. So
I just want to move on, and I will come back to this whole section of primary health centers, because that's linked to something else I wanted to ask. But before that, I'd like to just ask Dr. Pooviah, because you're in a unique position. You see elderly people who have multiple morbidities, and you also correspond with specialists who deal with them. So coming back to my original question, do you think that there is, because our traditional systems are very holistic systems, and do you think there is an issue here with such specialization?
No, actually, this is quite a vexing question which occurs in everyone's mind nowadays. But I feel that medical knowledge now has expanded to such an extent that the human brain does not have the capability to execute the very complicated tasks that lots of us super specialists are managing nowadays. Now, there are, yes, relatively fewer numbers of doctors in India as per our population. However, India, the unsung hero of healthcare are not the hospital-based specialists. And I say this with some degree of experience, because I have the privilege of both working as some sort of specialist, as a geriatrician, but also as a general care physician for older persons. And by far, your family physician is the unsung hero of medicine. He or she is the unsung hero. They are the generalists. They have to have an overarching view of medicine. These guys have to know about how to treat a 1-year-old child with some problem and the 80-year-old gentleman with dementia, as well as recognize angina when it happens in a 60-year-old. Amazing guy, amazing guy. So in our system of medicine, we are training specialists and we need them. We need the subspecialists, we need the super specialists, but at the same time, we need to have a large bank of just generalists, general physicians as well as general surgeons.
Everyone wants to be a specialist these days.
Lots
all the doctors I know.
Yeah, lots of underperforming guys like me don't.
You're a very valuable exception. But that's my experience when I see young doctors. They're all studying for this NEET exam, and they all want to the postgraduate exam, and they want to become specialists. And you're right that we actually need a really good pool of family doctors, general physicians. That's traditionally been the case in India, that they've actually know everything about the family, quite apart from their health. Many, they're personal and friends of the family. That's a shrinking base at the moment, isn't it?
The good thing is that now DNB have got a family medicine subspecialty, and they are trained to be overarching
DNB
physicians.
is a specialization.
Yes, it's a specialization, diplomate of the national board. It is something akin to an Indian MRCP or an FRCP or an FRCS. So that's an excellent move by the health education authorities to formally train and equip physicians to deal with a multitude of problems.
Can I, while you're still talking about this, can I just ask you a set of questions which are related? One is that, what is happening with India today is that more and more families are getting fragmented. The extended joint family frameworks are breaking down. How does that impact, because you deal a lot with people who are older, how does that impact on them? Generally, this nuclear family, this tendency, is it a positive thing in some ways?
Unfortunately not. Unfortunately not. Two factors come into play here. Fragmented families are leading to a lot of loneliness in older people. There's a mental health side to it. People are getting lonely, especially one spouse passes away, then there is a significant and a very palpable deterioration in the health of the surviving older person. Not just a family is getting splintered. It's a very poignant experience I had just yesterday with a patient who lives in a family with their 2 grandchildren, son and daughter-in-law, who told me that no one comes into her room, and she's unfortunately immobile. So today, because of the very busy lives that we all lead, we don't have time to go back to our older persons. So loneliness is not just for those who live in nuclear families, but also for those who live in joint families today. It's because of the various social pressures, media, etc. The fact that now there is an economic pressure as well as a justifiable requirement, or rather need, for women to join the workforce, which is a good thing. However, that has led to certain breakups within the traditional framework of families. Now, this has an impact, like I said, with the mental health side of things, the loneliness aspect, but also the physical health side. So the older person may not have somebody, for example, to hold them when they go to the toilet, as simple as that. As a consequence, they may suffer a fall. The younger people in the household may not have the time or the knowledge, meaning the awareness of the fact that an older person is sick and needs to be taken to a healthcare professional. So there has been a significant impact on social mobility and social change on the healthcare of older persons. Now, to cover this gap, lots of organizations have come up, and that is the positive spin-off. For one, it gives employment to a number of younger people, and lots of these organizations have now come in Calcutta, where I work. And lots of these are like individual startups, a few boys in the locality recognizing that older people in the locality don't have anyone to take them for healthcare follow-ups. They are giving them these services, and these services can be something very specific that, okay, when you want me to take you to the doctor, take me to the doctor, to something very all-encompassing, something like a surrogate child, where they even go and pay your bills for you and take you to the doc, buy your medicines, make sure you have stuff to eat at home, make sure the shopping is bought in for you. Can you imagine? I have seen a case of scurvy. Scurvy. Yeah? This is a disease which we associate with, sailors about 200 years ago on ships who didn't have access to fresh food. But I've seen a case of scurvy in Kolkata. And that's just because this older person didn't have the wherewithal to do shopping every day. So someone would come with some amount of food once in a week, cook all the food and put into a fridge. And this person would just go and take it and reheat it in a microwave and eat it. So the freshness of the food wasn't there, the vitamin C wasn't there, they got scurvy. So this is the social impact of the way things have splintered up.
That's fascinating. Thank you so much. Mrs. Sharma, you live in Mumbai. People in Mumbai can't afford to move out. They all live with their families till they're much older because of the price of properties. Does that have an impact?
I think, no.
Isn't that true, that there are a lot more people in Mumbai, children living with their parents because it's unaffordable for them to buy another place, in a sense? So, I was not commenting on that, but more about how that would influence this, all the matters that Dr. Pooviah spoke about just now.
He spoke such, thoughts of wisdom, something that we all can learn from and incorporate. But we, as a couple, also lived away from my father-in-law, just 5 minutes away. So, but we saw our in-laws every day, and so do a lot of my friends. In fact, it's a thing now that everyone, wants to stay, but we're still very close, and that's the important culture of India and the values that India brings about. That you may stay, a little far away just to give you that sense of space and freedom, but you're still connected to your families. And it's our Indian culture, Indian values that, bring about that.
Excellent, thank you. Dr. Bose, I want to address the next question to you. In your write-up, you've mentioned that in the Mission Hospital and the other institutes that you've been instrumental in setting up in the Durgapur area, that certain procedures which are very expensive and out of the reach very often of the common man, not because of the fault of anyone, but because of the cost of machines and various other elements to the procedure which make it expensive, that you've been able to do some kind of a cross-subsidy which has made it affordable. So cardiac surgery, for instance, generally is quite expensive. Would you like to just tell us a little bit about that?
Cardiac surgery is esoteric surgery. It involves high level of precision and skill, and the cost of consumables and disposables are stuff which you use once and throw it away. So, and the cost of manpower and the cost of the operation theater and the ICU and the cost of money which is involved to get the thing into shape is phenomenal. So therefore, where does the poor people come in? So we do about 200 heart surgeries every month, but at least 30 to 40 are done at a substantially low rate, especially for children below 18 years of age. I have no feeling for anybody who smoked a cigarette for 30 years and then got a heart attack. I tell them, you spend 5 lakh rupees on cigarettes, you bloody well spend your money on cardiac surgery. So basically what we do is we have categories of rooms like in all corporate hospitals. So we charge heavily for the experience that we have as cardiac surgeons for the higher category of people. There are a lot of people going from Calcutta. In fact, 20% or 25% of the high category beds are filled by people from Calcutta. But the lower grade of people, the general ward, the free ward people, we are actually not making any profit and giving it to the patients free of cost or at cost, depending on people, so that with this theory of cross subsidy, we can serve across society and fulfill my desire to be a part of society and do something for my country.
Thank you for that. We have very recently, all of us have experienced the phenomenon which is the kind of closest global phenomenon of our times, which is the COVID pandemic. That is definitely something which has brought everyone, maybe not together, but with the knowledge that this one event, this little virus, has been able to invade the whole of humanity, in a sense, has crossed so many bridges. We've all known people who've either had COVID, and very often we've known people, we've lost, close people we've lost to COVID as well, all over the world. It's not just in India, everywhere. Other impacts of COVID have happened. We've breathed cleaner air. I remember a friend of mine who lives in Jalandhar. He sent me a photograph of the Dhauladhar range from Jalandhar on an early morning, which he was able to see in all its glory after 30 years. So that brought home, to a sense, the impact we are having on the planet with all our activities, with all the things we call activities to progress. Because we are no longer breathing that clean air. We are no longer able to see that mountain range. But I wanted to ask my panel, everybody here, that how do they see how COVID has impacted, if in any way, our relationship with others and our relationship with the world? Can I start with you, Dr. Pooviah?
COVID was really a defining moment, at least for my generation and for lots of people here. I think, now we are going to talk about before COVID and after COVID. So BC will now become before COVID. Yes, in terms of the physician's perspective of this, one is that people have started after COVID taking things more seriously with regards to their health. We saw people dying, lots of middle-aged people saw people dying of their own age group. We ourselves, lots of us had the fear of ourselves catching some serious illness and passing away from it. And in all fairness, we realized the fragility of health. We had become too comfortable. So yes, lots of people started exercising regularly. So there were lots of positive fallouts from the fact that we had this huge pandemic. The receptiveness to adult immunization is now easy. Before we had to convince people to take a pneumonia vaccine. Now people come and ask us for the pneumonia vaccine. So that's a huge change it has had. So it has had a change with regards to the physical health. From the point of view of social isolation, we are still sort of facing the fallout. Social isolation, which happened in COVID among families, has affected their health even till today. Lots of issues are there underlying. For example, families who had to spend time together may have had a lot of time spent with activities with each other, but older people who were alone at home had a huge sort of deterioration in their health. Older people depend upon physiotherapists or some sort of therapist to come to make them exercise. So for 2 years, they didn't exercise at all. So that is going to have an impact on their health now. So these sorts of, the impact of COVID was huge. So there has been a positive impact and there's been a negative impact too.
Dr. Bose, one of the things which has happened with COVID is that the world has shared more information, and also the world has shared more resources. Would you like to comment on that?
True. World has definitely shared a lot of information amongst each other. Previously, in the first epidemic, I got affected by COVID. I was admitted for 3 weeks. Saturation is down to 85%, almost getting ventilated, but somehow got saved. But had I got affected 3 months earlier, that time there was no particular knowledge about what was the COVID-19 virus doing, whether it was doing pulmonary embolism or doing this or doing that. So by the time we knew that steroids did some work, and there was a lot of other medications which subsequently proved that they were not efficacious. So, but knowledge came from Italy that COVID, you have to take steroids, and pulmonary embolism is one of the most important causes of death. But I'll tell you personal experience. I've been married for how many? 40 years. So, I realized that I used to get out of house at 8 o'clock, come back at 9 o'clock, 9:30, and my contact point with my wife was that 1 hour waking up, breakfast, and that half an hour after dinner going to sleep in that period. And during the COVID, I was there with her for 18 waking hours a day. It's a huge amount. And we were like two parallel lines. We never agreed on anything. Our beshi din COVID thakle, I think we would have been separated. But thanks to us, we had one child called Miru in our house. My health's daughter, whom we kind of adopted, and she kept us enthralled, and we could survive that period.
Sorry, may I just add another very interesting perspective. There's been a lot of sharing of misinformation too. We shouldn't forget about that. Yeah? All the various remedies and it's amazing, you know, the amount of stuff people have taken to keep away COVID. Absolutely, somebody should write a thesis on this.
So, Mr. Sharma, tell us how important, we've heard about doctors working 18 hours a day. How important is work-life balance to health and happiness and family?
Well,
family
I
happiness.
think, of course, like I said, yoga asanas or, doing your pranayams or breathing practices, affirming things correctly to yourself, and basic things like prayer and basic health hygiene habits, if they are like taught to even the masses of India right from the start, there'll be a complete balance in the family, in the society. I remember I volunteered with my aunt who started Hospital on Wheels with the UNDP. And I went with her to Chhattisgarh. And there was this thing called cleft lip. It was just one stitch that had to be removed, and all the children could live, happily and peacefully, instead of being called like they were cursed by the witches or things, absurd stories like that. And small stories and small things like this, if we just, bring about awareness of the important forms, again, coming back to yoga only, our ancient secrets, I think there'll be a happy community and a happy world of.
Yes, there is a lot of evidence that keeping a place for every element of your life, whether it is yoga and exercise, whether it is work, whether it is social interactions. We found that social interactions are so important in keeping people from depression, even keeping people from getting dementia. It's one of the most important factors, communication and being with people, avoiding isolation, and also this whole work-life balance, not only doing work, is such an important issue. But I wanted to get on to something more general and perhaps a touch philosophical. And I wanted to start with you first, Dr. Pooviah, which is, we come from a tradition where acceptance is a part of what we are led to believe is right. How much of that have you seen play a positive role in your patients who've got either chronic or terminal illnesses?
Absolutely. Before I go on to that, just one it's such an important take-home message about the last discussion we had about COVID. COVID showed us one thing clearly, that if you exercise regularly, it showed us the importance of exercise in a very stark manner. People who were overweight and who didn't exercise landed up in ITUs. And those who didn't, who exercised regularly and kept the weight down, breezed through it. So very, very important. So sorry I allowed that to butt into the current
May
conversation.
I add to it, please? Like you said, exercise, yoga asanas does cover everything. Like there are 30 asanas, which are the asanas that benefit you physically. So you don't need to go to the gym and work out like crazy. You can just, do the yoga asana at home if you want, on your yoga mat, or,
True,
with
true.
pranayams, which again has to deal with breath.
Right. Quite right. Sorry, coming back to the question that I was just asked to speak on. Absolutely. And we all, fortunately, die one day. A few of us have the good fortune of dying in a flash, but most of us will suffer a significant amount of illness and, as a result, disability in the last years of our life. Now, there are two ways to approach this. In a great many sort of instances, what happens is that we naturally have great expectations of the professionals treating us, and we try to fight the disease. That's a great thing, but up to a point. India and our philosophies, our religion, and our teachings have constantly stressed on the point of acceptance, accepting the inevitability, and accepting the fact that lots of things are beyond human capabilities. Acceptance definitely helps us cope better with specific symptoms such as pain and, of course, disability. I've had the privilege of working in two cultures. I worked in Britain as well as I worked extensively in India now. And there is a stark difference at the way we approach ill health. Whilst Western philosophy and Western thought tend to be more proactive, they tend to take better care of their health up to a point, but when they fall ill, they tend to be less accepting of the illness itself. And as a result, there is a greater degree of dissatisfaction and unhappiness. Whilst in traditional Indian thought, acceptance of aging, acceptance of ill health, and acceptance of the fact that a divine power governs things in your life help us deal in a more placid and in a happier way with what will happen to a lot of us in the coming years.
Thank you. Thank you. This is the last question I shall ask my esteemed speakers before I open up to the audience for questions. But Dr. Bose, I'd like to ask you, and go back to that point which we were talking about, which is the wellness centers, the primary health centers. The government today is pushing through Ayush the increased visibility and practice and patenting of Ayurvedic, for instance, formulations, and other disciplines which have traditionally been part of Indian healthcare and medicine. We have these primary health centers which are chronically understaffed by allopathic physicians. He wants to transform them, the government wants to transform them into wellness centers, which I would assume incorporate naturopathy, yoga, as well as other disciplines in these centers. Do you see a future where this is possible? And if you do, how is it? Do we have a need, for instance, of a barefoot doctor, who can go to the more distant rural centers and have a set of basic skills, a special training program like they had in China, where the village doctor was trained in scientific medicine, very short, 3 or 4 months, and the scientific doctor was also, because this happened in the Cultural Revolution, also forced to learn about traditional techniques. That's been quite a successful program in China, and 2/3 of Chinese village doctors today actually come from that barefoot tradition. They have a health minister who was once a barefoot doctor. Do you think that this is something which will work in India and we should do?
I think in my last time I spoke, I was talking about physician assistants and nurse practitioners. And well, what I want to say is that there is a tremendous resentment among allopathic doctors about their inclusion into the health system. What will happen to us? But I tell you, none of these allopathic doctors will go to the village and practice. Then who will fill the gap? If there is a son of the soil who is a naturopath, an Ayurvedic or a homeopath doctor or any Unani doctor, and if he is able to diagnose and treat basic ailments, I think it's a wonderful idea. A. And B, being a hardcore heart surgeon, rationalist and all of that, when it comes to my treatment, I think prevention is the best method of treatment, and I did fall upon Ayurvedic and yoga. I do the pranama and the Surya Namaskar 12 rounds every day.
There you go, Mr. Sharma.
And additions at least 10,000 steps every day. And follow the same principles, the age-old food principles like sequential meal pattern. Have salads first, have water first, then have the salads, then have small portions of every food, and then count your calories, and then you are much healthier. See, all of us death is the biggest celebration in life, and we will all go through that. But to see that you die well and you live your life till you're dying, I think is the best thing that we can do for work-life balance. Everybody must have a hobby, and everybody must do something different other than me doing cardiac surgery or she doing something or all of us doing something. So basic happiness and relying on traditional methods for prevention rather than cure, I think is the best thing forward. And primary health center, being a wellness center, can also usher in preventive healthcare aspects, mental well-being, and so many other things. And the Westerners have given it a different name. They call them physician assistants. I think that's a 2-year course for them. And they have nurse practitioners. Now these physician assistants and nurse practitioners are actually better than most doctors. In my operation theatre, I got 5 physician assistants who have been assisting me for the last 15 years. They are better than a fresh MCH who comes from All India Institute of Medical Sciences or somebody.
Because of the experience over the years, yeah, absolutely.
India
Yes.
also has the Narayan method of telemedicine, which exists in South India. I think that's something that Mr. Bose probably spoke about also.
Sure.
The
I'm not sure whether we
telemedicine.
have time to talk. I wished that we had time to talk about this aspect, which is, how telemedicine will and can impact our country, a very populous country, which is still mainly rural, how it can
Telemedicine is a very good business model. I know of one hospital, their annual turnover in telemedicine is 100 crores.
Sure. No, I believe that. But I mean, how is this something which we should look at also in terms of efficiency, in terms of, saving time for both doctor and the patient, etc.? What do you think, Dr. Pooviah?
Yes. Again, coming back to the old question, all systems of medicine have a lot to offer us. Traditional Indian medicines are a huge repository of some wonderful treatments, even for very complicated diseases which allopathy medicine has no answer for. But what we significantly need in our country for ourselves and to contribute to the world is some sort of standardization, and Ayurvedic medicines, traditional medicines have to expose themselves to the rigor of proving their effectiveness through randomized controlled trials. That's when they are going to get acceptability in mainstream medicine and contribute to the rest of the world. Coming to the issue of telemedicine is the future. India is not just a powerhouse in terms of providing health care professionals, but we are also a powerhouse in providing software and sort of the connectivity professionals. We've got the cheapest internet prizes in the world. And so telemedicine is the future. We are a widespread country. I come from, traditionally, I have still a foot in my rural home in South Karnataka, middle of the forest. We've got the closest city is about 180 kilometers away. That's where the super specialists sit. So I have to have a means of my local doctor being able to communicate, my PHC being able to communicate with that doctor. Telemedicine is the future and certainly will be the future. It's a good business model and it's also good for the patients, it's good for the doctors.
Thank you for that. And with that, we have a few minutes left for audience questions. I would request you to keep your questions down to as short as possible in the interest of being able to have the maximum number of questions. Can I start with the gentleman sitting on this table here?
Dr. Mukherji, you specialize in memory. So we would like to hear something about memory sharpening from you.
Yes, I have a particular interest in memory disorders, but it's a vast topic. We were talking basically about people whose memories start to fail. Memories start to fail with time anyway in most people. It normally starts with names, that people are unable to recollect names first. That often starts as early as your 40s. And then, and that's normal aging. And in the normal aging process, memory can continue to deteriorate. It varies from person to person. But dementia is an altogether different thing, which I don't want to go into too much detail about, but there are a whole series of things which can cause dementia, not just Alzheimer's disease. There are other conditions like blood pressure, uncontrolled blood pressure, particularly in our country. We see a lot of cases of dementia because of that. To keep your memory intact, engage with people. One, engage with people before playing chess and doing Sudoku. Talk to people, meet people, go out, interact with people. That is kind of rule number one. And then read, stay interested in things, work if you can. All these things are helpful in keeping your memory intact. Sorry? I'll talk to you about that in the lunch break. Can I take another question?
Dr. Mukherji, I have a question. This is to the general, anyone in the audience, on the panel. We talked about Ayurveda and specific practices, but I wanted to know if there are general cultural family values. Can they have a preventive dimension in healthcare? For example, just simple practices like eating together, or washing hands, not bringing, footwear in the house, just general family values.
Dr. Pooviah, you want to take that?
Thank you. Certainly, of course. And across the world, depending upon the climate we live in, depending upon the area we live in, there are certain cultural practices we have. And all these cultural practices in our individual cultures come down from ages. Now, not wearing your shoes in the house, great idea if you live in a tropical country, terrible idea if you live in a cold country like England, because you'll have chilblains. Your toes will fall off one day. So it depends upon the culture you live in. Yes, but there are certain universal truths like eating together. So the knowledge of eating right, as Dr. here mentioned, how you eat, the social interaction you have with your family members, you ask each other about each other's health. The young people take care of the old, and the old people advise the young about certain good values and pass them on. So each culture has its, positives that they pass on.
Are there any traditional dietary traditions which are bad for us? We shouldn't do?
Traditional, the word tradition by its very essence means that we have tried that.
It works.
And
In
it works.
in
So I
yoga
don't
there
think
is-
anything traditional is particularly bad. Yeah.
Okay. So we can all eat ghee. Don't forget that.
Yes.
I said we can all eat ghee since it's in our tradition. Dr. Bose has something to say about that.
So, you about diet? Talking about diet? Diet, yeah. So, the oils which are good for your heart, see, when we Indians do cooking, our cooking is done at 380 degrees centigrade. So, when we cook at 380 and beyond degrees centigrade, the oil degenerates into saturated fats, and that's bad for the body. The only three oils that do not disintegrate are coconut oil and mustard oil and ghee. And people say olive oil, but olive oil, when you mix it with salad, it is good, extra virgin. But if you are again cooking it and putting it at 380 degrees, then your fats are all screwed up. But the best thing, and another thing I must tell you, that fat is not bad. Pfizer company, I'm taking my name, you can sue me. Pfizer company of USA has told us fat is bad. Why? Because it wants to sell its Lipitor. And it has earned so much money that Indian economy will go 4 times. So, please, my dear friends, fat is not bad. Eat fat. What is bad is refined sugar. See, in heart attack, which is the commonest cause of death, today if you do a treadmill test, today you do a coronary angiogram, all normal, but can have a heart attack tomorrow. Why? Because if you are smoking, if you are having a diet which is rich in refined sugar, they will cause the internal lining of the coronary artery to rupture, to form a crack. And in that crack, the platelets will accumulate. Anuchakronika bolta hai Hindi mein. And the platelets in English. The platelets will accumulate and cause a heart attack. So therefore, Coca-Cola has told that sugar is not, Pepsi-Cola has said sugar is not bad. So therefore, they have sold trillions and trillions of US dollars by selling sugar. Now they are saying sugar is bad. In their ads, it is written that sugar is bad. It contains sugar and sugar is bad. So therefore, it is all part of a design which is designed in the US and we are part of it. In Durgapur, when 2008, when we went, अरे दुर्गापुर दारुण डेवलप हो गया, लेकिन क्यों? अरे भाई KFC आ गया है and McDonald's have come and latest development is Burger King has come. अरे, they are all screwing our body by giving sat fats and moida and flour. Your diet should be least in moida, in flour and wheat products and rice products. 1 cup of cooked rice is 120 calories. And you run in the treadmill for 1 hour, you will see, they will say, 100 calories only. So, what will you eat? 1 6-inch roti is 130 calories. If you don't take 3 rotis, pet nahi bhadega. So, raat ko neend nahi aayega. So, basically, what yoga teaches us is to sleep hungry, to be able to sleep hungry. And if you are able to sleep hungry, you will become a fitter individual.
So in yoga, like we said...
Thank you. I've been instructed that we have to now close the session.
But KFC is good, sir.
We are the only obstruction between you and lunch, where I'd advise you to find out in which kind of oil lunch has been cooked. We've heard that there are only 3 kinds of oil we should be eating. Just to very quickly summarize, India has to offer the world an enormous amount in health, apart from all the other things that we heard about, generic medicines, doctors kind of being sent overseas, nurses being sent overseas. We are a big hub for medical tourism. We are also a big hub for setting up facilities in different countries. So on that high note, we have a lot to offer the world. Thank you for your patience. Thank you for listening. I hope you've enjoyed this session and enjoy your lunch.
Please remain seated for a minute. Please. Health is wealth, they say. And what a wealth of insights we have gained today. after hearing from such experts. We heard some very revealing statistics about Indian contribution in healthcare, right from ancient times through yoga and Ayurveda to current times through Ayushman Bharat. India indeed represents Vasudhaiva Kutumbakam, being a melting pot of cultures, practices, and knowledge in healthcare. We thank all the speakers for taking out time from their busy schedules to be a part of this seminar. As a token of appreciation, there are some gifts from the Chinmaya Mission and Imami group for our speakers that will be handed over by our volunteers. Another small announcement I have to make is, you will see a QR code being flashed on the LED screen. This is for a feedback form. Kindly scan and give your feedback. This will help us immensely. Thank you. As Dr. Pooviah said, that accepting the inevitable is a virtue. I request that we all accept that this little delay was inevitable, and we have cut short our lunch break to 40 minutes. Please proceed for lunch and be back in your seats by 2:30 so that we can start our third session on time. Thank you.